In your Health Watch, new data from the Wisconsin Department of Health Services shows Wisconsin has tallied 2,365 cases of pertussis or whooping cough just this year. According to DHS, half of those cases are from people between 11 and 18 years old. Wisconsin trails just Pennsylvania and New York in terms of total cases, again, just this year. Now, joining us to talk about that and a few other health topics is Dr. Bill Hartman, clinical trialist at UW Health. Dr. Hartman, appreciate you making time for us on this day after Christmas.
Absolutely. Thanks for having me.
So let's start with those whooping cough numbers. Fortunately, the DHS has not reported any whooping cough deaths, but the numbers, they're not encouraging. What do you take from these trends?
Right. So nationwide, there's about 32,000 confirmed cases of whooping cough, and this is up higher than anything that we've seen in the last decade. Here in Wisconsin, we have the third highest total number of cases at just over 2,300. This is up from only 51 cases that we saw last year, so a considerable increase. And like you said, half of these cases are between the ages of 11 and 18. And so there's probably a couple of factors that come into play. Number one, these kids have been in school, in confined spaces. I think we have to check and make sure that the filtration systems in our schools are up to par so that we can filter out as many of these viral and bacterial infections as possible. And the other thing, and a thing that we keep hitting home on, is that we really want to make sure that people are vaccinated. And so there's 5 shots that for pertussis that are given to kids early on. There's another one that happens after your 11th birthday, a booster shot, and that's the one nationwide. Also, we saw a dip in the number of people getting that booster vaccination, and that could be causing some of these increases in numbers that we're seeing.
Yeah, and that age range especially, I think, just points the eyes right to school. Let's change topics now. There's no generic version, I should say, of Ozempic just yet, but it looks like perhaps a recent approval from the FDA could change that.
Right, from Novo Nordisk, who makes Ozempic. They have an earlier version of this drug called Victoza, which is also in this GLP-1 family. They are talking about releasing the generic version of this, which really will have an impact on lowering the prices of these medicines, which is something that's very important because there's a lot of people that want to try these medicines for the tremendous health benefits that they give, including cardiovascular benefits, losing weight, controlling your diabetes. But the cost has been too high. And it has been obstructive for some people to be able to use it. With a generic now present, hopefully decreasing those costs will make it more affordable for more people.
And we ran a story earlier this week that more employees are asking their employers, hey, as part of our benefits, can you actually help cover this to bring some of that cost down? And I think a generic would certainly help with that. Okay, finally, this one I found really interesting. A new survey from CNET shows more than half of millennials and Gen Zers say they struggle with sleep over the holidays. Doctor, what advice do you have for them, perhaps struggling with stress over these, over this week or so?
Sure, especially going into the new year and into 2025, we all make resolutions to eat better, have a better diet, get to the gym more consistently. But one of the things that we don't often say, but we probably should be saying, is we also need to sleep better. And especially during stressful times, our sleep gets further interrupted. Up to almost 50% of people in the U.S. Have interrupted sleep. And so anything that we can do to relax our brain before going to bed, including things like just being more organized, exercising more, decreasing our alcohol intake, watching our diet, all of these things are things that will help us get that restful and rejuvenating sleep that we need so that we can feel rested and ready to take on the next day.
And there you go. We call that news you can use. Take it to your house, your cousin's house, wherever. Dr. Bill Hartman, appreciate you making time for us.
Thank you.